Lakeland Currents, your public affairs program for North Central Minnesota. Closed captioning is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org.
Hello again, everyone, and welcome to Lakeland Currents, where tonight we're going to be talking about something very important to all of us, our eyes. If there's anything more important, well, I suppose there are some things more important, but the eyes are a very, very vital part of having a healthy life. And my guest this evening is Dr. Seth Dokken, who is an optometrist from Staples. He has his own business over there, and I believe you have another doctor with you over there.
Multiple doctors.
And we were just talking about this. 10 or 11 years ago, you were on, and we both look like we're elementary kids, and now we look like we're old guys. I look like an old guy, and you're just a little
more
bit
gray
older.
hair for sure.
It's great having you here.
Thank you. Thanks for inviting me.
There's been a lot of development of new technologies, but there are three basic diseases that affect people that we're going to talk about first. And should we make the first one cataracts?
Yeah. No, thanks for having me. It's just awesome to be on. It has been a few years, so it's good to catch up on these things and talk about all the new developments that are happening for sure. In terms of ocular disease, cataracts is a huge disease. The world's leading cause of blindness is cataracts, and I think us as Americans, we don't realize how wonderful our healthcare system really is, where we can fix a lot of these issues. Cataracts is a disease where the lens inside the eye starts to get opaque, and there's a photo that I wanted to show up where there's two boys, and you'll see one is kind of blurry and one is clear, and that's kind of your blurry one is your cataract eye, and your clear one is your post-cataract surgery there. And the surgery, what they do is they go in and they take the lens out and they replace it with a new lens. It's about a 7-minute outpatient procedure. 99% of the time, the surgery goes just like we want it to, and there's always risk with any surgery, but it's very common surgery, most common surgery in the United States of America, and most successful surgery in the United States of America is cataract surgery. In terms of the new developments is, what's really taken off there is some of the multifocal technology and the toric implants and the laser-assisted cataract surgeries, and where you're taking some of those trickier parts of surgery and taking it out of the surgeon's hands and doing it with a robot. And I always tell patients, it's like, if you wanted to cut a board really straight, would you use your saw in your hand or would you use your CNC machine, And I think that's what's really happened there for sure. So
if some of these poorer countries that don't have medical help, don't have the finances, if someone that were to lose their eyesight from cataracts, could that be
restored?
Fixed?
Absolutely, for sure.
When
we run mission trips and things like that, where we will run into patients that are just completely blind from cataracts, and we take that lens out, put a new lens in, and it's definitely fixable. It's amazing, it's life-changing for a lot of.
Can you imagine that? Living in Laos or someplace where you're blind, and someone comes in and the next day you can see?
Vision is very important, just like what you were mentioning earlier. There was a study, actually, I think it was about 20 years ago, where they said, what do you fear the most? And death was number 3.
Really?
Alzheimer's was number 2.
Optometrist
and
was
blindness was number 1, exactly. So people feared death actually less than they feared blindness, so is what the study said back then. And so, I think it's a wonderful gift to go to work every day. It's a blessing to help people with their vision and accomplish these things.
What does, and I've had cataract surgery, but from your perspective, what is it that starts to happen that people notice?
Usually they'll think they need new glasses. I would say 90% of our patients that come in that need cataract surgery will come in and say, hey Seth, you know, I'm here, I got these glasses a couple years ago, I'm just not seeing very well out of them. And we'll take a look at all that stuff and we'll just have to sit and have an honest conversation to say, well, if you get a new pair of glasses today, you're not gonna see any better. If you wanna see better, you really gotta do surgery. And so that is the most common complaint. Night driving, you know, oh, I can't night drive anymore, or I was at my granddaughter's volleyball game and I was having a hard time telling which one she was. That is your very, very common cataract complaint. The other type of cataract complaint is the reading side, where patients just say, you know, I can read this Bible or this book, but I need a lot of light on it. I just can't see it as well as I think I should be able to. And those are the cataract complaints.
And some people you hear say they see things yellower, more yellowing.
For sure. Cataracts changes your colors dramatically, and it really makes your vision off color-wise. Every year we do cataract surgery, and I have patients that need to repaint their house or get a different car because they had bought a certain color car when they had cataracts, and then they had cataract surgery, and then they don't like the color anymore.
It's
they
been
have
that
to
drastic?
repaint the bathrooms or things like that.
Wow.
Yeah, for sure. It does really change your colors, kind of yellowing up your vision and making it dull for sure. So.
Is there any way to prevent the development of cataracts?
Well, you know, sunglass protection is definitely needed. The other thing is just generally being healthy. You know, I think of the typical diabetic or you know, somebody who's not smokers as they're going to be early cataract surgery. You know, if I see a typical patient, it's probably 7 years old when they're getting into some cataract discussions. You add a diabetic to that mix and it's 60 to 65. You get some bad family history there. I mean, you get 55-year-old cataract surgeries. The youngest surgery we did last year was 29. And that was trauma, you know, so sometimes you'll get into trauma situations, motor vehicle accidents, four-wheeler accidents, something happened, somebody got hit, and they'll develop a cataract. It's kind of like a chip in a windshield of a car, where if a rock hits it, it can definitely throw it off. So,
what are, don't want to scare people, but what are some things that could go wrong when you have that surgery?
Yeah, 100%. I think most of the things that can go wrong are very fixable. You know, obviously there's a mild infection risk. 1 in 10,000 cataract surgeries does get an infection. Then you have to get some antibiotics on board and try to clear that up. The lens can move. I've seen that happen a few times, where you get into a motor vehicle accident or a big fall, airbags are deployed, things like that. The lens can move on you, and so then we got to kind of resuture it back in place. Pressure issues, and that's why you're watched so closely right out of cataract surgery, is sometimes when you're in doing the surgery, the drains of the eyes can get clogged and the pressure can go up, and you just have to pop some medication on board. You know, but like I said, 99% of cataract surgeries go very, very well. And I don't think any surgery is 100%. You know, they wouldn't call it surgery if it was easy. It's always complicated, for sure.
Well,
so.
Let's talk about another disease that I think all of us are afraid of. Glaucoma.
Yeah, you know, glaucoma is a tough disease. You know, again, there's two boys on the picture here. One is a normal eye and one is a glaucomatous eye. What happens in the glaucomatous eye is where the peripheral vision will start to constrict. And so in a normal eye, you have good peripheral vision. In a glaucoma eye, you start to lose that peripheral vision, usually because of pressure. If the pressure in the eye is too high, it'll damage the nerve. That's the connection between the eye and the brain. And if that nerve gets damaged, then your peripheral vision goes away. Again, a lot of new advancements on the glaucoma side. You know, when I first started practicing 15 years ago, glaucoma treatment was put patients on medication. Now, actually, the current recommendation is to do some of these surgery things. You take a laser and you laser out the drain, or you put a stent in with your cataract surgery, and most of those patients are not even on medication anymore.
Wow.
Because medication has side effects, it has cost, you forget to do it. It's kind of like a heart, where it's like, okay, you can take this medication the rest of your life, or we can put this stent in and just fix your heart. Same thing with these stents in the eyes. What they do is they drain off that pressure, and I would say nobody should go blind from glaucoma anymore.
Really?
The patients who do, either the practitioner missed something or the patient is not listening. I think it's such a fixable disease that you do some sort of surgery or some sort of drops, and you can really prevent a lot of issues with that. So glaucoma has been a heavy advancement over the last 5 years, and I'm sure it's going to get better.
Wow.
Sure. So
That's just encouraging to hear that you don't see people going blind from that anymore.
Not
Because it used to
very.
be the kiss of death.
Yeah, not very often from glaucoma. I mean, it certainly can, but somebody is not doing something
It's more
right.
rare now.
Yeah, it's pretty rare. It's like a controlled diabetic, where you're going to die of something else. It's like a prostate cancer, where this is something where we've got this A, B, and C that we're going to do, and this should turn out very, very well.
How about
on the glaucoma
the
side.
other big disease, macular degeneration? That's
Yeah.
a little more complex, isn't it?
Certainly complex, but again, there is a lot of development there. So for the last 20 years, we've had some treatments for wet macular degeneration. There's two forms of macular degeneration. One is wet macular degeneration. The second one is what's called dry macular degeneration. So for the last 20 years, we've been doing injectables for wet macular degeneration. That's a macular degeneration where the eye will bleed. Macular degeneration is a disease where the central vision goes away. So when you look at those two little boy pictures, you get that center picture there of that one boy where you just lose the middle of their face. And in wet macular degeneration, what we do is we inject a drug into the eye, and it absorbs that blood. And really, it is, again, a little great, where those patients' vision are really holding. Just this year, the FDA approved a treatment for dry macular degeneration called Syfovre, and it is the first treatment that has come on board for dry macular degeneration. There's a particular form of dry macular degeneration called geographic atrophy, which is a pretty devastating form. And this new treatment that just came online in the last 6 months or so has really shown some promise there. So I think that gives our retina specialists some tools for the toolbox that they didn't have before. So we used to think of wet as treatable. I do think, over the next 10 years here, we're going to also think of dry as treatable. The last time I was on this show, dry macular degeneration was all about prevention, Ocuvites and Preservision, and getting your multivitamins on board to prevent you from getting dry macular degeneration. And now there is an injectable. It's pretty rare where I've seen it done at this point, just because it's so new. I think the doctors are trying to figure out, how do we do this? Which patients are going to do well with it? Where do we get it? Is it insurance companies? There's all sorts of variables there.
Is that where they inject directly into the eye?
They
then?
do. Yep.
Well, that sounds pretty freaky.
It's not that bad. No, it is the best way to treat an eye. If you have an eyelid problem or other body parts, but for an eye, you really have to target it. That's a very isolated tissue. So most of the time, eye doctors are using drops or surgeries or injectables going, into the eye. We do so many, and the safety protocols are so high that you're you're not going to have a lot of issues. So.
Let's just talk generally a little bit about eye care. I mean, I think most people think, well, you're going to have safety glasses and that's eye care.
Yeah.
But there's a lot of things that we can do to take care of our eyes, aren't there?
Absolutely. General health matters. You know, the diabetic issues, the high blood pressure issues, those types of things matter. If you're going to have health issues, you're going to have eye issues. Your eyes are going to follow that continuum there. So for surely taking care of yourself, exercising on a daily basis, those types of things are going to matter, your systemic health. Second thing is safety. You know, dermatologists, I think, are smarter than eye doctors probably, because whenever you go outside, you're always putting on sunscreen, and they've really said, hey, we want to prevent you from getting melanoma, we want to, protect your skin. Well, same exact thing falls for your eyes. You know, when you go outside, you need to put on good protective sunglasses every time. Your eye is the only structure in your body that lets light in, and we know how damaging light is to your body. 1/3 of all melanomas are here. 1/3 of all melanomas are either around an eye or within an eye.
Really?
I see patients every week that have said, hey, I got a little bump going on right here. What do you think that is? And I'll be like, well, you need to go talk to dermatology. That looks a little suspicious.
I didn't realize that.
And so, I do think anytime you go outside, you've got to put your sunglasses on. That's kind of one of the main causes of cataracts and macular degeneration is sun damage inside the eye.
I know you told me one time that the worst patients sometimes you see are farmers who are out in the field all day without sunglasses.
Yeah, I mean, that is true. I mean, if you're outside all the time, you really got to protect those eyes. You just can't let light get in all the time. It's going to be damaging to the structures.
What are some of the new technologies that you're dealing with? Because I know a lot of progress is being made.
Yeah.
But before you answer that, where does most of this research occur? At universities?
Universities, yeah. You've got the big research institutions like where I went to school in Chicago. Those are where a lot of the research, it'll disseminate out to this central Minnesota, like that new drug that was approved this year. There are retina specialists in St. Cloud that are using that drug, but it's not where the research is happening. That's usually either like the U of M or the universities is where the research is happening. Technology-wise, what it's made is it's just made it a lot easier to track things. Like, for instance, in a glaucoma situation, I can take a picture of a nerve and tell the nerve integrity right away. I can say, okay, this nerve has 93% integrity, and I can pull another picture in 6 months, and if that 93 drops to a 91, I know that, okay, I lost 2% of nerve in that last 6 months. I need to get more aggressive on their glaucoma. On the macular degeneration side, I think 10, 15 years ago, you were always guessing, is this dry or is this wet? And again, with a quick little picture, you can tell instantly, this is a patient that's going to need an injection, or this is a patient that I'm going to just continue to watch. On the Optos side, that technology is searching for melanomas. So an Optos is a machine that takes a photo of your eye, that way you don't have to dilate as much to look for lesions inside an eye. They did a study with an Optos. You were 80% more likely to catch a melanoma in the eye with the Optos technology on board.
Really?
So our patients were doing that technology all the time. I mean, you save lives doing this stuff, So that's the new technology on the ocular disease side. On the multifocal implants, that's the cataract surgeries where patients, I think 10 years ago, you told patients, well, you're probably going to wear glasses after cataract surgery. Now, I think there's a discussion there where it's where a lot of patients, you say, do you want to wear glasses after cataract surgery? If you do, awesome. If you don't, there's some things that we can do to make that a possibility. I would say still the vast majority of our patients are going back to glasses after cataract surgery, but at least there's options on board. And on the glaucoma side with the stents, it's been amazing where you can just put a stent in instead of taking a drop every day. It lowers your pressure automatically without you thinking about it or doing anything about it, for sure.
So do you still dilate once in a while?
Oh, for sure.
Okay.
Yeah. I think if you are making surgical decisions or if you're really kind of questioning what's going on, the best way to do it is to dilate, you know. But there's a lot of patients that you can really not torture nearly as much with the new technology and get a lot of data, you know. And I think medicine has went that way as a whole. You know, if you ask somebody, about it, you know, do you do this or that? A lot less torture, and they're getting a lot more information other ways, for sure. So.
What are, as doctors in your field, what are some of the frustrating things you deal with? With patients? Yeah,
I mean, I think the frustrating thing that I deal with patients is where you do tell them that this is a serious disease, this is fixable, we got to do this or that, and then they show up 3 years later and you say, well, what's been happening over these last 3 years? And they say, well, you know, I didn't think it was that serious or things like that. The eye is a nervous tissue. So just like a spinal cord injury or, you know, a traumatic brain injury, I mean, if you start to damage nervous tissue, it is kind of that holy grail where we're not that good at fixing it. Are we better than we were 20 years ago? Absolutely. If you have a spinal cord injury now, you know, you might walk again. But if you start to damage an eye and nervous tissue, it is very, very difficult to get that eye back. So prevention is the absolute way to go there, for sure.
So getting people to take you seriously when you're giving out the warnings, and I don't mean you individually, but the doctors, pay attention to what they're saying because they know what they're talking about.
Yeah, for sure. I mean, I think that's the thing with healthcare is that you have to be your own advocate. You have to go in and say, hey, you know, consistently, I need. My eyes feel fine, I'm seeing fine. Well, guess what? They're looking at other things. They can catch that early macular degeneration. They can catch that early glaucoma. If your vision is perfect, awesome. And if your eye exam comes out perfect, awesome. But I do think, you know, an ounce of prevention goes a long way there, for sure.
I know, I think the cataract surgery started in the Vietnam era.
Yeah.
Is that right?
Yep, for sure.
And tell us how they were originally replacing lenses in that era.
Well, so in that technology, it was glass lenses, right? And glass doesn't bend. And so you had to make large incisions in order to put this glass lens in the eye. So they were working on blind eyes at that time. And they actually took they took his license away because it was such radical surgery at the time. They said, like, this guy should never be allowed to operate on anybody. And then, you know, as he got older and they put him in the Hall of Fame, you know, or they said, like, wow, this guy revolutionized this. But glass lenses back then, and that's what some of our patients will remember where, well, I don't know, mom had these sandbags on her head and she couldn't move for a week and they were putting these lenses in. With the new foldable technology, what happens there is that they put this lens inside your eye, and once it's in, then they'll unfold it. They'll, you know, play a little origami inside your eye, and they'll put that lens in place. And patients who have surgery will tell you that. They'll say, well, they were doing something, and then all of a sudden I could kind of see better. You know, a lot of lights going off, and so that's what happened with the original cataract surgery.
How often do you recommend? I'm sure different age groups have different requirements, but how often do you recommend a patient seeing a doctor like you?
Every year.
Once a year?
It's a huge program of our association, check yearly, see clearly every year. And then even the little ones, we really like to see them right around 1 year old.
Oh, wow.
And even younger, if there is, the primary care physicians notice something, or mom notices something, or dad notices something is off with this 1 year old's eye or this 6-month-old eye. I mean, you can get some great data off of little kids. And then every year thereafter, we say once a year, even if you feel like you're seeing great. The vast majority of insurances consider it wellness, so it's covered. You just have to make the time in your schedule to go in and get them checked, so.
In about 30 seconds, tell us about ocular migraines.
Ocular migraines are common, I suffer from them myself, where you'll get this aura, flashing of light. It's going to be there for 10 minutes or so, and then it goes away. If you get a flashing of light that persists, that's when you really do want to get in, So everybody will suffer from some ocular migraines. That's where you get this, aura and a flash. But if it persists longer than 10 minutes or so, you really do want to get that investigated pretty quickly there. So.
Because it could be a tumor.
It could be a tumor. It could be a retinal detachment. It could be macular issues. It could be all of those things. So any sort of flashing that's persisting, you got to get that checked out. Exactly, for sure. So, yeah.
How do people get a hold of you?
You can call the clinic. Our phone number is 218-894-1331. Email us, Facebook.
Staples Eye Clinic.
Staples Eye Clinic, exactly, yeah. So, and myself and Dr. Fentz would just love to see you. So.
Well, you do a great job.
Thank you.
You're very, very good at interviewing and presenting these diseases as we know them today.
Yeah.
And it's really encouraging to hear the progress that's being made in solving some of these problems.
Yeah.
Seth, thank you very much for jumping on board with us. Appreciate it very much.
Thank you.
You've been watching Lakeland Currents. I'm Ray Gildow. So long until next time.